Hello everyone. So in this video I'm going to tell you about the diuretics, which are potassium sparing diuretics. And the potassium sparing diuretics, these basically act on the collecting duct. So these act on collecting duct. So in the collecting ducts we have the channels, there is our channel where aldosterone acts. So these were the receptors for the aldosterone, and here the sodium channel will be there. Sodium channel from which the sodium gets reabsorbed and potassium and hydrogen get excreted. So potassium and hydrogen gets excreted. So this is the channel. So basically the sodium is helpful. Sodium help in removal of potassium and hydrogen. So these sodium and potassium hydrogen, all these act when the aldosterone will act on it. When aldosterone stimulated, then sodium reabsorbed and potassium and hydrogen is excreted. Now we can inhibit this process by aldosterone antagonist and by blocking the sodium channels. So these were two methods by which we can inhibit the aldosterone and inhibit the sodium channel. So first one is the aldosterone antagonist. So we have to inhibit these channels. So how we can inhibit? We can inhibit by two methods. First, if we block the aldosterones, and another one if we block the sodium channel. So first one is the aldosterone antagonist, and the second one is the epithelial sodium channel blocker. Epithelial sodium channel blocker. So here we have to know that all the diuretics were act from the luminal sides, but here the aldosterones. So here the aldosterone is act by the from the blood side. So aldosterone antagonist is the only diuretics which work from blood side, while rest other all work from the luminal side. So if the aldosterone antagonist will be there, or if the epithelial sodium channel blocker is there, then what will happen? Then there is decrease of sodium and water in the blood, means there is loss of sodium and water. Second, there is increase of potassium. That's why these diuretics were known as potassium sparing diuretics, because all the diuretics were decreasing the potassium level. But in this one these were the potassium sparing diuretics. So there is increase of potassium because potassium is retained in the blood. So potassium retained will be there, and there is increase of hydrogen level. There is increase of hydrogen level in the blood, which if plus sign is more in the blood, then it leads to the metabolic acidosis. Metabolic acidosis. Now for this we have the mnemonic, that is the PASTE. So PASPE, in which P stands for the potassium sparing diuretics. A stands for the amiloride. E for spironolactone. T for trimterone, and E stands for aplerenone. In this, the spironolactone has the side effect, that is gynecomastia. It can lead to the gynecomastia, while the aplerenone, it doesn't cause gynecomastia. Now we have to learn the uses of the potassium sparing diuretics. So for the uses of potassium sparing diuretics, the first one we can use in the Cohn syndrome. In the Cohn syndrome we can use, and in the edema of cirrhosis we use potassium sparing diuretics. And because there is compensatory increase in aldosterone in cirrhosis patients, so there is retain of water which lead to the edema. So in that case also we can use. And the third one, in the prevention of hypokalemia we can use, and in the congestive heart failure we can use the diuretics, and in also the resistance hypertension patient we can use the potassium sparing diuretics. Resistance hypertension patient we can use. So all these were the uses of the potassium sparing diuretics. That's all for today video.